In another committee room, the Committee on Health held a one-day public hearing, an investigative hearing on two bills and a motion. The bills are Federal Oil and Gas Hospital, Beni Krukru Delta State Establishment Bill 2025, sponsored by Senator Joel-Onowakpo Thomas, representing Delta South, National Agency for Malaria Eradication Establishment Bill 2025, sponsored by Senator Nwoko Ned Munir, representing Delta North. The motion under investigation is the urgent need to investigate with an intention to halt the continuous unwholesome practices of chemical ripening of fruits among fruit sellers in Nigeria. It was sponsored by Senator Ani Anthony Okorie, representing Ebonyi South. The event gathered stakeholders across the sector as well as the region. Declaring the event open, the President of the Senate, Godswill Akpabio, who was represented by Senator Neda Imasuen, said through the hearing, the Senate reaffirms its commitment to improving healthcare, promoting public health, and legislating on the urgent needs of Nigerians, adding that it was time to move from campaigns to eradication, backed by law, science, and accountability.
This hearing reflects the Senate's unwavering commitment to improving healthcare delivery, protecting public health, and enacting legislation that meets the urgent needs of our people. Today's agenda speaks to three important health priorities. 1. The Federal Oil and Gas Hospital Establishment Bill, which proposes the creation of a specialized medical institution in Beni Krukru, serving communities whose environment and health have been impacted by oil and gas exploration. This is a matter of environmental justice, access to quality health care, and developmental fairness for oil-producing communities.
Civil society.
At the event, Senator Banigo Ipalibo, committee chair, emphasized that the hearing underscores the committee's dedication to its mandate, allowing expert insights to shape informed decision and recommendations. She thanks stakeholders for their active participation.
Today's hearing of our committee, expert opinions and experiences, which will enrich our understanding and inform our final recommendations on the floor of the Senate. At this point, permits me to appreciate all the stakeholders present here, which include government agencies, professional associations, civil society groups, members of the media, members of the public. Thank you for honoring our invitation.
The sponsors of the bills took turns presenting brief overview of their bills.
The objectives of this bill is to provide a comprehensive medical service for workers in the oil and gas industry, as well as communities affected by oil explorations in Delta State.
And so what does it take? One is an act of parliament, which is what I'm advocating for now, dedicated to addressing malaria ailments. It will be an agency like any other agency, funded from, charged with the responsibility of making sure that we have data of everybody who is affected by malaria. They will make sure that they focus on investing in vaccines for malaria.
It is to be noted that the artificial ripening agents such as ethylene, carbide, and all sorts have been reported to be toxic for human consumption. But in many developing countries, Nigeria, these harmful chemicals have been of rampant use. So it is the intention of this motion to halt this unwholesome practice.
Some stakeholders disagreed with the move to establish a national agency for malaria eradication sponsored by Senator Ned Nwoko, alluding to a duplication of functions of existing similar agencies.
We looked at them and we brought out some items. The first one is institution fragmentation and bureaucratic duplication. So we looked at the provisions of extant acts like the National Environmental Standard and Regulation Enforcement Agency, their functions, the functions of Nigeria Center for Disease Control and Prevention, the National Malaria Elimination Program, National Primary Health Care Development Agency. These are agencies that are funded by taxpayers' money.
But there's no malaria clinic because it involves everything and everybody. Because of this, we like to move and suggest that the current, although we appreciate the creation of the Senate decision to mobilize resources and focus attention on malaria activities, but we think creating an agency is not the solution.
After the deliberations, other stakeholders took over with their submissions.
We are related. And we are related because we actually bear the brunt of the oil and gas exploration activities. So we are in total support of the establishment of the oil and gas in Benin community.
So our recommendation is to the committee to enforce existing laws. I mentioned the Criminal Code Act and then the constitutional powers assigned to local government for grassroots food safety regulation and enforcement. Local government should be allowed to focus on grassroots food regulation for food vendors, while federal agencies retain their oversight functions as food safety is a national security issue.
The committee promised to compile a report on the hearing for presentation to the Senate for more legislative action.